Thank you all for coming. I'm sorry we're a little late. We went to the wrong building and then came over here. So today we're going to be talking about the new 988 Behavioral Health Crisis Line. The crisis line is part of a larger Crisis Now model, which is a huge model that's going to take a few years to actually get up and running. So I'll introduce that whole model today, but most of the focus is going to be on the crisis line itself. So we'll talk about what the crisis line is, where we're currently at in the process, and where we hope to be headed. So just to introduce myself before we start, my name is Allison Kellum, and myself, along with Aida over here, we are program evaluators with SBS Evaluation and Program Development Specialists. But today we're not here as evaluators, we're here as contractors to the state to provide this training. Because I'm here as a contractor, it means that I am not 988 staff, nor am I state staff, so I may not be able to answer every single question that you have. But if a question does come in that I'm not sure about, then we will pass it along to the state, who will get that answered for you. But the reality is that not every question might have an answer, because some of the things we'll talk about today are still in the development process. So before we begin, we do just want to start with a land acknowledgement to recognize that we are meeting, living, and working on the traditional and unceded lands of the indigenous people who call New Mexico home. The original peoples of New Mexico, Pueblo, Navajo, and Apache, since time immemorial, have deep connections to the land and have made significant contributions to the broader community statewide. So we do just want to honor the land itself and those who remain through the strength and resilience of generations. Okay, so what is 988? 988 is a 3-digit phone number that acts as the behavioral health counterpart to 911. 988 is a federal initiative, so it was signed into law in 2020, but with the pandemic, it's taken a little bit of time to get going. But as of July 16th, it is now currently live in all 50 states and all 5 territories. 988 is really an effort to support 911 crisis intervention by having trained behavioral health staff respond to behavioral health emergencies. So the goal is to reserve 911 for medical and public safety emergencies, while 988 can be used for behavioral health. And really 988 is there to help people feel heard, get grounded, and get access to resources that they might need. Before we get too far into the presentation, I want to give just a quick definition of behavioral health to make sure we're all on the same page going forward. So behavioral health can kind of be seen as an umbrella term for mental health, so things like depression, anxiety, psychosis, and substance use. So it's really an all-encompassing term for both of those things. This is particularly important for New Mexico because, as I mentioned, 988 is a federal initiative. So federally, they're kind of advertising 988 as a different suicide prevention lifeline. But here in New Mexico, we recognize that suicide prevention is not the only behavioral health concern that we have. We also face really high rates of substance use. So with 988, we want to encourage everybody to call for any sort of behavioral health crisis. So then something is considered to be a behavioral health crisis when a person is unable to effectively care for themselves or reach out to resources on their own. So a person might call 988 when they're having thoughts of self-harm, suicide, or harm to others. They can also call when they're experiencing emotional distress, substance use, or a mental health crisis like psychosis. But 988 is not just for the person in crisis. You can also call 988 on behalf of someone else. So friends, families, teachers, shelter volunteers, you can all call 988 for someone else. If this happens, the operators might coach you on how to engage with your loved one, or they might help connect you to resources or services that you can get them the help that they need. So now that we know what a behavioral health crisis is, let's talk about what this might look like in practice. So on the screen, you'll see some events that could lead to a behavioral health crisis. You'll notice that these tend to be transition points in someone's lives, or just an event that can be really overwhelming to deal with on their own. So for example, during the pandemic, a lot of people lost their jobs or experienced feelings of isolation. This could definitely cause a behavioral health crisis and would be a reason to call 988. Another reason is after losing a relationship. So this could be like a teenager who's going through their first heartbreak or an adult who's navigating a divorce. You can also call when substance use reaches a breaking point or when you have run out of psychiatric medications without access to a refill. So it's important to note that the number is not going to connect you to a provider to get a refill, but it will help give you some skills to cope until you're able to get that prescription refilled. Another reason to call is when you've experienced a traumatic event or witnessed one. I think this one is particularly important for our purposes here today because we know that many of the people in the shelters may have experienced significant trauma on their way here, and so this could be a good resource for them to call to get some help coping with that. But also you yourselves might experience trauma from hearing about other people's trauma. So it's a good resource to just call and talk about whatever you may need to discuss. So why do we need 988? Well, 75% of Americans are not content with the current status of mental health treatment in our country. This is across the aisle, regardless of political affiliation. Generally, 75% of Americans feel this way. And while most people generally feel that law enforcement is doing a good job in their community, they also fear that law enforcement should not be the primary first responders when a behavioral health crisis occurs. We know that there is a lot of fear and stigma surrounding law enforcement response in many communities, and so with 988, it will allow people to get the help they need without fearing that a law enforcement officer is going to come to their door. And really, it just makes sense to have people who are trained in behavioral health on the scene because they're specifically trained in these sorts of behavioral health de-escalation techniques, and so they're better prepared to respond to these types of emergencies. Diverting behavioral health calls to 988 is also just more effective. So by and large, Americans do not believe that a person having a mental health crisis should be taken to jail, which is what currently happens in many communities that don't have the capacity to handle behavioral health crises. So again, the goal of 988 is to have a trained behavioral health professional respond to these emergencies instead of law enforcement, because they're specifically trained in care, and so so they're able to handle these emergencies much better. 988 is also more fiscally responsible. So when mental health crises are diverted, the number of ambulance trips and hospitalizations decreases, which also reduces the burden on the healthcare system. As I mentioned, 988 and 911 are very different. So 911 focuses on medical and public safety emergencies, while 988 focuses on mental health and addiction crisis services. So these two systems are also going to look very different in practice. Previously, you may have seen law enforcement surrounding a person in crisis and sort of shouting them into submission, using that show of force de-escalation. And while that might be appropriate for public safety emergencies, that's not really what we want for behavioral health. And so now with 988, you'll see someone who is not in uniform, sitting down next to the person in crisis and really speaking to them on a more personal level, showing this show of concern de-escalation technique. I mentioned at the beginning that 988 is part of a larger Crisis Now model. So this is that model. This is a huge model that's going to take years to actually get up and running, but I do just want to lay out the plan for you all. So we're currently in phase 1, which is the crisis line. That's the only part of this plan that is currently active, but everything else is in planning and development. So when you first call 988, you will be directed to NMCAL, which is the Crisis Center for New Mexico. They have been for many years. All of the operators are master's and bachelor's level clinicians and social workers, and so they are very well trained to be able to handle any sort of crisis call that might come in. 80% of the time, the counselors will be able to resolve the call on the phone itself. So they'll be able to talk to the person in crisis and de-escalate them or do some safety planning or provide them resources. Really just do anything that helps the person feel as though their situation has been resolved. If they feel that there is a need for emergency services, they will keep the caller on the line as they contact 911, who will take over the situation from there. However, it's really important to note that most of the calls don't result in any sort of 911 dispatch, and of the calls that do result in 911 dispatch, over 90% are voluntary. So a very small percentage of calls will have an involuntary 911 response. And the only time that that is going to happen is if someone is actively speaking about harming themselves or harming someone else, in which case the operators are bound by state law where they have to contact 911 for life-saving interventions. But that's not happening very often. So if further intervention is needed, then the operators can dispatch the mobile crisis teams. I'll talk about this in more detail later, but these teams are teams of behavioral health professionals that are actually dispatched on the scene and go talk to the caller in person. These aren't quite there yet. The policies and procedures are still being developed. However, there are going to be a couple of pilot sites in New Mexico, the first of which should be coming out hopefully next month, if not by the beginning of the year. So you should start seeing them come out pretty soon. And 70% of the times that they go out in the field, they'll be able to resolve the situation themselves. If people just need a little bit more help, then they can help transport people to crisis facilities. Again, I'll talk about this in more detail, but these are basically places that people can go. They're completely staffed by behavioral health professionals, and it's basically a place that people can get out of the environment that is triggering their behavioral health crisis to go and stabilize and get resources that they might need. Afterwards, there will be a post-crisis wraparound where they check back with the person in crisis to make sure that they have stabilized and gotten any sort of resources that they might need. This is important because 988 is recognizing that it's not enough to just treat the crisis itself, but you also want to prevent the crisis from happening in the first place and then giving them appropriate services to try to prevent it from happening again. This entire model is less restrictive, so it decreases the use of emergency department trips, inpatient care, and jail time. And so because it's less restrictive, it also means that it is less expensive to run. 988 went live in July, so it is now currently available to call, chat, and text. Really the emphasis for who can access 988 is for people who are age 14 and older. That's because 14 is the age of consent for medical decisions in New Mexico, so that's why that age is chosen. However, anybody can still call 988. So if a child calls, the operators will still answer the phone, and they will try to first, they'll try to see if there's an adult around who can get on the phone with them. But if there's not an adult around or not a safe and trusted adult around, then they will still talk to the child and try to help resolve their issue. The only thing is that because they're younger than 14, they can't consent to like the mobile crisis team coming or going to a crisis triage center. But they will still try to resolve it. So 80% of the calls go to NMCAL, which again is our local lifeline for New Mexico. And 20% of the calls are routed elsewhere. So this 20% includes calls that go to Agora, which is our state backup center. And it also includes calls that go to national centers. So this could be veterans who have their own dedicated veteran crisis line that's staffed by veterans and veteran families. It also includes Spanish speakers who are routed to one of 3 national Spanish-speaking centers. NMCAL is currently working on building the capacity to take Spanish-speaking calls in-house, but that's not quite there yet, so at the moment they are still going to the national sites. And we also have a TTY line for people with hearing challenges. In terms of language, right now the line is only available in English and Spanish. However, they do use Language Line to provide translation services to 250 additional languages. I did check on this, and these languages include Brazilian Portuguese, Haitian Creole, Turkish, Ukrainian, and Russian. So the most common languages that might come through the shelter are available with the translation line. Right now, only the text and chat feature are only available in English. Again, they're kind of working on building this to have Spanish speakers be able to text in, but that's not the case as of right now. When you call 988, you will first receive a greeting where you're told what 988 is, and then you'll be given 3 options. Press 1 to connect to the Veteran Crisis Line, press 2 to connect to the Spanish subnetwork, and the third option is to remain on the line to be connected to your local crisis counselor. From there, a trained counselor will answer the phone and really listen to you and try to figure out how your problem is affecting you and how they can best manage that problem. So this could include providing resources, safety planning, or crisis de-escalation. And again, if the local line doesn't pick up, then you will automatically be rerouted to the National Backup Center, so there should never be a reason why your call goes unanswered. 988 is currently available to chat and text. These are two new features that were created and went live with the line in July. So to text in, you can text talk to 988, and from there you'll be connected to a counselor. This feature tends to be really popular among young people, perhaps unsurprisingly, but a surprising amount of older adults also use this feature as well. So I wanted to show a really quick example of the beginning of a text conversation. So you can kind of see what it looks like. I think sometimes it can be intimidating to reach out to resources if you don't really know what to expect. So the video doesn't have any narration, but I will narrate it for us. If it comes up, there we go. So the person types in and says, "I need some help." The counselor says, "Thank you for contacting our 988 text line. My name is Amy and I am here for you. How can I help?" They say, "Hi, I don't know. I'm not sure where to start." Amy says, "That's okay. It can be hard to start. Why don't you tell me what prompted you to text in today?" They say, "Well, I'm 16 and school is really bad. I did something bad and now everyone is bullying me. I'm not sure what I'm going to do if it gets any worse." And then Amy says, "I'm really glad you reached out today. Let's talk about it." Okay, so that was a really quick example of a text conversation. It's also an example of one of the social media campaigns going out there. This was posted on TikTok. So I think it can be helpful because the person who typed in didn't really know where to start. They just knew that they needed to talk to someone. And I think that's pretty indicative of what happens in most crisis situations. You don't really know exactly what to do. You just know that you need to talk. And so the crisis counselors will be there to help you and ask, the right questions to get that out. The chat feature is available at suicidepreventionlifeline.org/chat. When you chat in, you will be connected to a pre-chat survey to assess your primary area of concern. And then from there, you'll be connected to a counselor. If there is a wait time, a little box will appear on the screen that will tell you how long you need to wait for a counselor to get back to you. This isn't happening very often right now, but if it does get to the point where a lot of people are using this, then a wait time will appear. And this feature tends to be really popular among professionals at the workplace who want to be a little bit more discreet with contacting 988. One of the big questions and areas of concern that we often get is in terms of privacy. People want to know, if I call 988, is someone going to show up to my door? Are they going to know this information? What about my data privacy? Things like that. So 988 does protect your privacy, and one of the ways it does this is by routing you to your local call center by area code instead of using geolocation. So geolocation is what 911 uses to be able to find you even if you're unresponsive. So like if you call in for a medical emergency and then you go unconscious, they're still able to send resources out to you. This is important, of course, for medical and public safety emergencies, but it's not really necessary for behavioral health. And so instead of using that, 988 uses area code. While this protects privacy, it does create some challenges for people who keep their old phone number after they move. So for example, I live here in New Mexico, but I'm from Virginia and I still have my Virginia phone number. So if I call 988, I'm actually going to be connected to the Virginia Crisis Center. Most of the time this is fine because again, 80% of calls can be handled just over the phone. So the Virginia counselors would be able to talk to me, give me skills to cope or de-escalate me, things like that. So most of the time this is going to be okay. Also, just to note that people with international phone numbers can still call 988. So people who come through the shelters and have their old phone numbers, they can still use this. It's just because they don't have a recognized in-country area code, they are automatically going to be sent to the national line, and they will be able to take their calls there. In terms of data privacy, sometimes when you contact 988, you might be asked to fill out a survey. This survey asks for demographic information like your age, ethnicity, zip code, primary language, things like that. But this survey is completely voluntary. You don't have to participate at all. You can choose to answer some questions, but not others. You can choose to answer none of them. If you choose not to participate, it's not going to affect your service in any way. Really, the only reason that they're asking for these questions is so they can figure out who is contacting 988 and, more importantly, who is not contacting 988. So if they see that most people who are contacting them are between 20 and 40 years old, then they might want to figure out a way to let people who are over 40 and 20 and under 20 know that there's resources available to them. But again, it's completely voluntary. 988 is being funded through a variety of ways, mostly federal, state, and local funding. Okay, so the other main question that people always have is this even worth it? With 988, we're switching to a completely new system. It takes a lot of time, energy, and effort to switch to a new system, so people want to know if it's worth it. Hopefully, I've explained that from a social standpoint, it is, because it's saving people's lives and giving them resources that they need. But we know that some people, that's not enough. They want to know the nitty-gritty. They want to know the financial aspect, if it makes sense financially. And so we can see that it definitely is. So these are some cost projections of how much it would cost to use the Crisis Now model in various counties in New Mexico. They were able to make these cost projections because there were 2 pilot sites of the Crisis Now model that were implemented in Arizona and Washington State. And so based on the data they collected there, they were able to do these cost projections. So the bar on the left is how much it costs to use the emergency departments and inpatient beds for behavioral health care. And then the bar on the right is the projected cost for what you will spend for the Crisis Now model. So again, the Crisis Now model is everything from the crisis call center to the crisis triage centers. And you can see that there's a significant amount of projected savings. In San Juan, there's an estimated savings of $14 million. Bernalillo County, $78 million, and Grant County has $3 million. And the amount of cost savings only increases with an increase in population density. Here's some more data from the pilot sites. So in Washington State, they found with the Crisis Now model, people were less likely to be placed in jail or a psychiatric hospital. In Arizona, they found that calls for law enforcement for behavioral health had decreased between 75 and 80%, which led to 22,000 law enforcement handoffs to mobile crisis teams every year. In Pima County, Arizona, in 2014 alone, there were about 4,500 law enforcement transfers to mobile crisis teams, which saved almost 9,000 hours of law enforcement time. This is pretty significant because when law enforcement responds to a behavioral health crisis, it can take them about an hour to handle that call. And so when you're diverting that call to behavioral health professionals that are trained to handle it, that's time that law enforcement doesn't have to be spending there as well. So they can be back out in the community and doing other tasks. Hopefully you guys have seen some of the 988 advertisements already. They're doing national and local campaigns with PSAs on TV, radio, and billboards, as well as social media. We're also doing local efforts to get the word out through public information sessions, and we're also going to all of the tribal communities in New Mexico to make them aware of this resource as well. If you are interested in looking at any of the flyers or social media, it's all available to download at 988nm.org, and everything is available in both English and Spanish. So that was kind of a quick look at what the entire plan is going to be on a federal level. So now I want to shift and talk about what this might look like in New Mexico more specifically. This image is another way to look at that whole map that I had shown earlier, and it's New Mexico's continuum of care. So recognizing that behavioral health is not the responsibility of just one person or one organization. It really requires a lot of people working together. So it involves the helpline, 911 when needed, the crisis centers, and the mobile crisis teams, but also emphasizes the need for community support and behavioral health professionals who are committed to providing same-day or next-day appointments. So a little bit more about the mobile crisis teams in New Mexico. These are going to be teams of 2 to 3 behavioral health professionals that would include a licensed clinician, a peer support worker, and some of them might include nurses as well. And they will go out on the scene and be able to respond to the caller face-to-face. They will be on call, so they will be able to go out 24/7. We know behavioral health care is not, a crisis doesn't fit a standard 9 to 5, and so these mobile crisis teams are not going to be that either. They will be able to respond 24/7. The goal is for these teams to be able to go out to anyone in New Mexico within 90 minutes. That's a lofty goal for New Mexico because we are such a geographically large state, but that is the plan, and we are ahead of schedule for meeting this goal. So the teams will be able to provide crisis interventions, screenings, assessments, referrals, and follow-up services. There are some mobile crisis teams that already exist in New Mexico. Many of them were created a couple years ago, and so they are not affiliated with 988. Because they're not affiliated, it means that they might not follow the same stipulations that the 988 mobile crisis teams have. So for example, Santa Fe does have a mobile crisis team. Their mobile crisis team is co-response, meaning that a law enforcement officer and a social worker go out and respond to calls together. All of the mobile crisis teams that are going to be created with 988 are not co-response. So law enforcement will not be involved with that response unless, again, they are needed for life-saving interventions, but most of the time they will not be involved. Similar to the crisis counselors, these mobile crisis teams will be trained on trauma-informed care, cultural competency, crisis de-escalation, suicide risk assessment, and safety planning. They will also be trained to carry naloxone, so they will be able to respond to potential substance use overdoses. And they are going to emphasize hiring peer support workers. So these are people with lived experience with mental health challenges or substance use, and so they will be able to help the callers in a different way with their lived experience. The crisis triage centers, again, are places that are completely staffed by behavioral health workers, so that includes clinicians, nurses, and peer support workers. And they're places that people can go to just stabilize. They get out of that environment that is triggering their behavioral health crisis, and they can go and get the care that they need, and then go back out into their community. So there are 2 types of crisis triage centers. One is an outpatient 23-hour model, and the other is an up to 14-day residential model. These centers are completely voluntary. They're not the same as like an inpatient involuntary care. They're completely voluntary. They're not going to accept anyone who is not there of their own free will. And these centers are for adults and children over 14. Again, 14 is the age of consent for medical decisions. However, the adults and children will be kept in separate units, so they won't commingle during their stay. There are currently 3 crisis triage centers in New Mexico. There's one here in Doña Ana, one in Albuquerque, and one in Santa Fe. These centers, again, are not affiliated with the Crisis Now model, so because of that, they might not follow the exact stipulations, although most of them do. You'll notice that all of those triage centers that I named are in the big cities. That's because they require a certain amount of population density to keep them up and running. They have to have people, coming through the doors to keep their lights on. This presents a challenge for people who are in more rural areas, because if they go to these centers, it's a really big disruption of care. So if someone from Gallup comes all the way down here to go to the crisis triage center, they're away from their family, they're away from their community, and it creates a really big challenge in terms of transportation. Like, how are they even going to get back to Gallup after they have had their services here? So because of that, the state is trying to consider different ways to be able to provide behavioral health care to people in more rural or frontier communities. So the next two slides that I'm going to show are examples for how they can get behavioral health resources to more rural areas. So the first idea is to create community crisis partners for hospitals. So this is a really close collaboration between a rural hospital and a behavioral health agency. So right now in more rural areas, when someone is having a behavioral health crisis, they often go to the ER. This presents a challenge, though, because many doctors who are in ERs aren't trained to handle behavioral health care. I've heard that some doctors only receive about 4 hours of behavioral health training, and so many of them just don't feel comfortable trying to provide services and resources to people experiencing these crises. So instead of relying on doctors, this model would allow for hospitals to contract 1 or 2 or maybe more clinicians to be on call to respond whenever needed. So how this would work is that the hospital staff will screen every person who comes into the ER or the hospital to see if their primary area of concern is behavioral health. If that's the case, they will contact the clinician who is on call, who will then respond to the hospital within 30 minutes. They'll then assess the patient and recommend appropriate care and services. And then after that patient has been discharged, the behavioral health agency will follow up within 24 hours to make sure that they have stabilized and gotten the resources that they need, and then potentially continue to work with them afterwards. The second idea is to create a community calming center. So this is a temporary facility that people can go to stabilize on an as-needed basis. So it's kind of, instead of creating a more permanent building, then this is somewhere that people can go for the time being, and then it will go back to what it was being used as before. So this could be like a room in a hotel, or a room in a clinician's office that's not being used, a room at a hospital that's not being used, really anywhere that the clinicians can take the person in crisis, go help them stabilize for 23 hours, and then it will go back to whatever it was being used as before. So you can kind of think of this like a pop-up shop. It comes up for the crisis and then goes back down afterwards. Okay, that was a really quick overview of this entire process. There are 2 main takeaways that, if you remember nothing else from this presentation, I hope you take away. The first is that 988 is currently available to call, chat, and text. There are counselors that are there that will help you. The second one is kind of the tagline for 988, which is someone to call, someone to come, and somewhere to go. So someone to call being the crisis center, someone to come being the mobile crisis teams, and somewhere to go being the crisis triage centers. Yeah, does anyone have any questions? Great. Well, thank you all. Appreciate it.